Thanks for joining us for our first ever Sonex Financial podcast. As you know, many of us have had to adjust our way of living and working during these unprecedented times. As we were preparing to return back to work and resume BAU over the coming weeks, whatever BAU looks like, we felt it was important to discuss living in a COVID world. We've got the Sonex management team here, and we are also joined by John Beeson, Professor at Cardiff University, and Mike Osborne, Clinical Psychologist. So if both of you would like to give us a brief overview of yourselves and your work. If I start with you, John, please.
Yeah, sure. Good morning. Yeah, I'm a psychiatrist. I work at Cardiff University and also in the NHS in Wales. And my special area of interest is post-traumatic stress disorder. So both in terms of research and my clinical practice, I look at trying to develop new interventions to help prevent and treat the effects of traumatic stressors, and also trying to develop services to help people who suffer from both post-traumatic stress disorder and complex post-traumatic stress disorder.
Great, thank you for that, John. And Mike?
Hi, yeah, my name's Mike Osborne. I'm a Macmillan clinical psychologist. I've worked all my career in hospitals, specialising in, benign chronic illnesses as well as cancer and what you generally call critical care, which is ITU and the like. That's been my main sort of specialism.
Great, thank you.
Right, okay, I think I'll kick off. John, I think this probably is a question for you to start off with. Experts are predicting, and initial reports from China suggest, that there will be an explosion of mental health issues as a result of COVID-19. What impact do you think COVID-19 will have on mental health? And what do you think will be the most common disorders?
I definitely think that we're going through a very stressful situation at the moment with the COVID-19 crisis. And to be honest, I think that the impact on different individuals will be quite variable. So I think we're seeing some very positive things in terms of human resilience at the moment, and the way that people cope. So I don't think that all of the reactions are going to be negative ones. I think there'll also be some positive ones. But sadly, I think the evidence is that people do find these situations very stressful, not surprisingly. And I'm sure, as we'll go on to discuss, some individuals are going to be more vulnerable to developing negative effects of the COVID-19 crisis than others. For me, I think that common types of symptoms that people will experience will be in the depressive domain, low mood, reduced interest, perhaps difficulties concentrating, motivating oneself, feelings of anxiety at the situation. I mean, financial pressures are going to hit a lot of people hard, I think, as a result of the COVID-19 crisis, and that will undoubtedly cause people to be worried, but also have a knock-on impact to individuals affected and cause depressive symptoms as well. For some individuals, they'll have much more what I would classify as classical traumatic experiences, for example, being confronted with death of themselves or others, and actually confronted with the death of others. So then I think they'll get into the realms of things like post-traumatic stress disorder in some individuals, and also grief reactions, which may become pathological, particularly given the fact that, given the restrictions and the lockdown, we're not allowed to grieve and go through our normal grieving rituals in the normal manner. So I think that we could well see more problematic grief reactions in the future.
Thank you for
Mike,
that.
have you got any comments you want to raise on that? Anything that?
Well, that's quite an encyclopedic summary. I really just want to say here to that. I think from a physical health point of view, it will, I'd be interested to, we need to learn more about this particular virus, but it seems to be quite a stubborn one that has a sort of lingering fatigue element to it. We've known about post-viral fatigue for quite a while, but I wouldn't be too surprised if in a year's time we've got issues more with prolonged duress as well as anything else, and the level of fatigue and functioning may well struggle. We may well struggle with that, but that's all for us to sort of find out, really. I mean, it's difficult enough having a long-term health problem anyway, and this is going to make it more difficult. This is not going to help those kind of patients that you guys have known about for a long time, and it could well push people further than they thought they could go, and it may well be that there will be period, tremendous transformations for some people, but I mean it's going to be a level of a load upon people that we probably can't quite predict yet.
Thanks for that, Mike. John, you started off and you were talking with regards to how resilient people have been, but the evidence also shows that more people are going to be struggling with mental health. I mean, we've seen 51% of customers that we've spoken to, when asked, have said that COVID-19 has already affected their mental health. Do you expect that percentage to be that high in general population?
I think that's probably a higher percentage, and of course you're dealing with a particularly vulnerable group in many ways, and therefore one would expect the rates to be higher. The early research that's coming out of some of the surveys that are being done at the moment show, maybe up to 30 to 50% higher rates of distress being expressed than are ordinarily expressed at the moment. And that said, and I agree with Mike's point, I don't think that we're seeing the full extent of the mental health issues caused yet, in that we're in the midst really of the crisis at the moment. So I would anticipate the actual figures going up to a degree. But I would have thought that, the proportion that you're talking about at the moment would probably be a third to half higher than I would expect amongst the general population, at least.
Great, thanks for that, John.
Yeah, I'll jump in here. 70% of the customers that we've already spoken to since the lockdown have said that they've already been impacted financially. Do you see financial pressure being one of the main drivers of poor mental health in the near future? Probably best put to John initially.
Yeah, no, absolutely, Stefan. I mean, my view is that actually the financial losses are going to be one of the biggest stressors of the COVID-19 crisis. I mean, I think we're already seeing very significant financial pressures for an awful lot of people, with loss of income being a major thing, and obviously loss of job, which will have some immediate loss of income, implications, but actually those will extend and become greater as time goes on. So certainly not having income coming in, having to face the consequences of that, for example, not being able to pay bills in the same way that they were before, are likely to be major stresses for people. And we know from previous research that actually financial insecurity and financial difficulties is very much associated with adverse mental health consequences. So I don't expect the pattern of the response to be any different here, but what I think we're seeing is all at once a sudden major impact on a much greater proportion of the population than would happen in usual circumstances.
And do you see any particular groups of society being more impacted than others?
Yes, I mean, sadly, I think that we're already seeing that the evidence is that individuals who are more vulnerable anyway are the ones that are being impacted most. So research is certainly showing that individuals who are more socioeconomically deprived at the moment going into the crisis are going to be more vulnerable than those who are, perhaps in the, better off and stable from a socioeconomic standpoint. I think there is, though, another thing that we'll see as a result of the COVID-19 situation that we don't see on a day-to-day basis, which is that some individuals who would never have thought that they would be faced with socio-economic adversity are going to be faced with socio-economic adversity. And I think that unexpected consequence will make some of those individuals even more vulnerable to adverse mental health consequences. So in short terms, and I mean, I've given a long answer, but I really do think that the adverse financial consequences of COVID-19 are going to have a major impact on the mental health of the population moving forward.
Fantastic, thanks, John. Similarly, Mike, likewise, would you see the same potential impact on physical health?
Yeah, I think it's tough enough having a physical health problem at the best of times. It's quite expensive being unwell, and it makes it difficult for you to be part of the mainstream and to basically earn money. This is going to make it more of a strain. Those with chronic fatigue-based conditions, or, as Jonathan just said, those who have had quite an acute problem, really, and have found that their ability to earn money has been just taken from them, has evaporated, and that will create quite a strong, in a way, quite a legitimately catastrophic change for them in that case. The term financial health is just an excellent phrase because it goes beyond just capital, it goes beyond revenue. It speaks directly to people's sense of security and people's comfort and optimism in the future. And it's hard enough for people with serious illnesses to manage at the best of times, but we're going to find out where the poverty is. That's what we're going to find out. And that's what happens in always when we go through situations like this. We find out where the people with the resources are. And also, maybe one of the things that might come out of this is the one thing in physical health, but possibly in mental health as well, is that it's always exposed this slightly complex relationship we have as a culture with money, where we've been sort of slightly uncomfortable with it. And those people that are financially literate and comfortable with money offer a great service. And I think maybe this will make us talk about money more openly and more transparently. That might help us in a way. But it has exposed that it remains one of the taboo areas around, and anybody that can offer financial advice and support is going to be offering a fantastic welfare service. Always has done and will continue to be crucial. It could well be one of the dominant drivers, and could well be one of the factors in resilience that is unspoken about. I suspect those people that talk about transformation are probably reasonably financially comfortable.
Brilliant.
One from me, probably for you, Mike, just following on from the physical health comments you've made. We're speaking to customers who have serious health conditions, in some cases terminal illnesses, who are seeing their treatments being either delayed or cancelled. How do you think that's going to affect their mental health?
Not well, obviously. Worry is chronic worry is our biggest concern. To be honest, acute stress, it's not our concern. Chronic worry, chronic insecurity, chronic pessimism, these cause problems sort of in the longer run. And a concern that's growing at the moment is that given an awful lot of services are being paused at the moment, we can't really keep this up for long. Because what we do know with physical and, to be honest, enduring mental health is that spontaneous recovery doesn't happen. You know, people will be, when you go back to find people, they'll be in a similar position. And it's possible, if we don't address this, that next year we've got an equally big a problem as we have now, in that there's an awful lot of people out there struggling a lot more, simply because they've been in a more complete kind of isolation than we imagine. So it's a significant issue. This it's a bit of a Hollywood myth that this makes people, it necessarily brings out the best in people. It doesn't do that at all. I think one of the things, the phrase we've been using a lot over the last month or so is that spontaneous recovery is very rare in these situations. And I think the assault on people's confidence and ability to function, not everybody, I understand that some people can do well out of this kind of situation, but the assault on our ability to function can be quite significant, and disability won't go down, it'll go up in that situation. So we'll have to be very mindful of this. maybe one of the things that will come out of this is that we will talk more transparently about money. I certainly hope we do.
Thanks for that.
Thank you.
Mike, you mentioned and sort of touched on it being next year. Do you think that's when you're going to see the main impact of this as being following into next year, or do you think it might be sooner?
I think it's going to unfold. I think only an arrogant fool can tell you what's going to happen in that particular situation. In 3 months, we'll know a bit more, and then as it will unfold. But I mean, certainly from a services point of view, even if the lockdown changes socially and culturally, I think the is going to be, we're going to be in a position for at least a year on alert, I think, and we're not going to really know. I imagine or we'll still be learning in 18 months, I think, as to how this has affected things, and we will find out where the ripples have extended to and what people have managed with. There will be amazing stories, but at the same time, I'm quite intrigued to know what will emerge that we would never have predicted. Yeah, it already feels, last February already feels like a lifetime ago.
Yeah, it certainly does.
Watching people on TV rubbing shoulders with each other, it just seems very strange.
Yeah. John, we talked about financial health affecting mental health. But if I flip that on its head and say, what aspects of mental health has the biggest impact on somebody's financial health? Is there a lack of capability to work out what's coming in and going up and outgoing, or is it the impact of their livelihood, their ability to earn, or spending to feel better? What's your viewpoint on that?
Well, my view is that the absolute biggest issue is whether people have finances coming in that are sufficient to cover their outgoings comfortably. So I think that trumps everything in many ways. But then I think the other factors that you mentioned will also come into and play a role. And of course, you can get a vicious circle going on. So if you're worried about whether your incomings are going to match your outgoings, that makes it even more difficult to sort of make, sensible, rational decisions about how to manage your finances appropriately. And people can start to panic, for example, and perhaps even make some unwise choices, if you like, about how to prioritize their finances and how to manage their money appropriately. So to that degree, they're interconnected. I certainly think that, let's say that somebody becomes depressed as a result of, financial difficulties or other issues, then the lack of motivation, the lack of concentration, the lack of interest, these are all factors that are not good when it comes to managing your money and your finances appropriately. I mean, obviously, we hope that with helping individuals to be able to do those things better, then they will be able to, to manage their finances better. But I also think that a lot of individuals, and this is, my view would resonate with Mike's view on this, that actually speaking to people that know what they're doing financially, who can actually give proper, straightforward advice and support to people in managing their finances appropriately, can be really, really helpful. I mean, you're probably very aware that within the National Health Service now, there's been a big move towards what's being described as social prescribing. And this is where an individual will go in perhaps to see their general practitioner with symptoms of depression, anxiety, but it be detected very early on that the cause of that really is not something that is likely to need medication or formal psychological treatment to get better, but the root is something else, and financial concerns are often a key one of those. And so social prescribing would involve advising an individual or arranging for an individual to meet with somebody who can talk through their financial issues with them. And I've seen several people in exactly that boat who've gone off and seen somebody and have actually returned better. You know, their anxiety is better, their depression is better, and they haven't come anywhere near somebody like me for treatment with medication or psychological therapy. But it's that, you know, what we're prescribing broadly as a social input that has actually been, if you like, the pill that has helped them to move forward.
Yeah.
Just on that point then, on about, you know, social prescribing, do you see that fundamentally changing the way that GP practices approach, you know, their patients, and how do they then, I suppose, introduce that into the conversation in relation to their condition?
Yeah, I mean, I think we've seen it already, and I think, but it's one of those things that is moving and it's starting to gain momentum. So, for example, the Welsh Government have been investing in social prescribing now in primary care, which I think is a very positive thing. And so once you've got the government backing and other people supporting it, then that practice is going to be commoner. I think we've known about this for years, that this is a sensible way forward, but we've tended to, in many ways, I think, sort of over-medicalise what I would class as sort of common mental health symptoms that are reactions actually to social stressors, where it would be preferable to take a social approach to them. Now my mantra is very much one of a biopsychosocial approach to trying to help people. So, you know, clearly there are lots of people with depression who do need, you know, medical, psychological treatment. But I think actually a significant number of people are pushed down that track, you know, rather than down a social prescribing track, which would be a much better way for them to go. So we are seeing an increase now. I think things like the COVID-19 crisis and the likely financial consequences of that should accelerate this process and mean that we are talking much more openly about looking at people holistically and about their situations as a whole, rather than, you know, coming to a doctor, looking at the medical symptoms and treating them that way. So I think the more that we can do to try and sort of highlight that, and I think this is a good example where we're trying to work together with people from across different sectors to put out a message that actually just going down a pure medical way is not the only way to go to help with your health and well-being and your, you know, and your finances. Then, you know, I think this is a real opportunity that we should be grasping and taking.
Great.
Yeah, I think that is bang on, I've got to say. And the idea that we're going to lean forward and say, and how are your finances? I mean, it just suggests, it shows that we're making progress in our ability to talk to each other about these things. I mean, we, you know, it's like talking to someone about their sex lives. It's like talking to people about their finances. It's almost like they'd rather talk about their sex life than their money. And we need to get to the point where that can be comfortable, particularly where people aren't particularly well. One of the things, because treatments themselves can be incredibly disabling. And one of the things we tell people in hospitals all the time is no one comes out of hospital feeling physically stronger, mentally sharper, more sociable, or sexier. And you need all four of those things to do well. It's quite a disabling, undermining kind of process. And within that, Jonathan was right, that there's no situation a human being, there is a risk that a human being can make worse. I mean, avoidance is out there. This is what we can do. And you finance people, you know the power of people, the ability of people to avoid their financial worries. It's unbelievable, really. You know, it's quite astonishing. Just one more point on the shopping as well. It's when we debrief people from critical incidents, there's a point where you lean forward and you give the talk and you say, watch what you're drinking and watch what you're smoking and watch what you're eating. Nowadays, we also say, watch what you're shopping as well, because shopping is another thing which in difficult circumstances can go a bit crazy, because it's so painless now to shop and to let that sort of run away with you, really. I'm sure banks love emergency personnel, because I bet they shop very, very well.
Mike, thank you. Very insightful, good answer. I guess for the next point that I wanted to cover was And a question to either of you. What do you think is the single biggest difference creditor organisations could make to better support those with mental health or financial health problems?
Well, from my perspective, I think it's understanding individuals and where they're coming from. So dealing with people in a practical, pragmatic manner that is empathic and supportive, I think is a really major way to, to approach these situations. One of the things that we found again and again and again is that people who feel they are being socially supported appropriately tend to fare better than those who don't feel that they're being socially supported. And I think that's something that we can all do. And clearly, people such as yourselves can play a major role in that. In my experience, it's often the people that people come across first in a journey, as it were, who have some of the biggest impacts on them. So if they've got somebody, for example, who's discussing a financial situation with them in a sympathetic manner that's understanding and trying to come to some sort of a solution that is mutually acceptable, then that's a really good way to be going. So being cool, calm and showing patience, clearly everybody's got a job to do. Everybody totally acknowledges that, I think, but there are ways of doing these things that make that much more painless than other ways of doing it. So I think being psychologically minded and supportive and empathic and not getting into arguments or anything like that make a massive difference to people.
Brilliant. Thank you, John. Have you anything to add on that, Mike?
No, I think that makes the difference. What we know, surely history has told us that punitive measures don't work. Punishment doesn't work. Shaming doesn't work. If you want to reduce someone's ability to function, to earn money, to pay back anything, then attack them, ignore them, don't understand them. What I've noticed over the last 20, 30 years is that there's a realization that's something something we've always known, but that is absolutely critical to human functioning. The punishment does not work, and nowhere is that more obvious than in trying to help people with their finances, because you've got to tell them the truth. There's got to be confrontation, because avoidance is a problem. But people only listen to you if they think you respect them meaningfully, and people only know what you know if they think you have their interests at heart.
And I think another thing to remember is that when individuals are stressed and vulnerable, which clearly people with financial difficulties will be, then they tend to be more sensitive and more prone to misinterpreting what's said. So being very careful to explain things in a very clear and open manner, checking in that people are understanding the information that's being imparted, I think is really, really important in these situations. Many's the time that I've seen, people being explained things and the person that's explaining it assuming that the person understands it in the same way as they do, and that's not the case at all. So often, just reflecting back, is that clear? Can you reflect back to me what I've just said? That can be a really helpful technique to try and make sure that you're both on the same page. The last thing you want to be doing is getting into some sort of conflict when actually you're both on different pages of the same hymn book, as it were.
No, I think you're definitely right, John, there. We clearly see that in our business on a day-to-day basis.
Yeah, I was going to say the same. I think a lot of what both Mike and John have said is comforting in some way for us, in knowing that the conversations that we're having with customers are difficult conversations. You're right, talking about money is extremely difficult and something very personal to individuals, but to add the other layer on there with regards to mental health or health conditions, physical or emotional, is peeling back the layers. You've got to peel back the layers to have that conversation and actually understand that individual circumstances and work with them to find a solution, as opposed to attacking them, as you said, and that is key in having the right results.
Well, sometimes, I mean, it sounds over dramatic, but you've got to adopt the same position as if you're talking them off a ledge. I mean, you know, because you've got to, it's the same process, because as Jonathan says, when we're in that situation, we're in quite a defensive, hostile, spiky, these are states. So these are sophisticated conversations, and really talented ones. I mean, one thing that intrigues me about your world is that the mathematics, to be honest, is not very complex. Maybe compound interest is about as intellectual as you need to know for your domestic finances, not in other areas. And yet you'll talk to people about, and they'll say, oh, I can't do money. And then you think, but it's not even maths, it's arithmetic. So there's obviously something there that's intimidating, that goes beyond intellect, goes beyond goes beyond simple logic. It's to do, that's what people are like, I think. And there's no situation a person can't make worse, and money seems to prove that to us all the time. Yeah, but why would you bayonet the wounded? I've never really quite understood that.
I think you've already touched on the question that I wanted to ask. It's more about our staff and for organisations like us. Because firstly, we have to remember that they're also going through this. So how can we support our staff better, and what skills should we be developing in them so they can better manage the very customers that we just talked about?
Well, I think to go back to what Jonathan just said, it's the ability to retain your composure and to be honest, adopt a more acceptance-based, realist approach, as opposed to something that is sort of quite mythical in a way. This idea that we can control some of these things and change some of these things. I think there has to be something that's based more on empathy and understanding. And critically at the moment, it's going to be about the chronicity. It's going to be about stamina and duress. People are going to do well, the people that are going to hold the nerve, I think. And as you say, not panic. And it's not going to be complex and heroic. We're going to go back to the basics of helping people. I think trying to keep thinking simple, because I've yet to meet anybody that's got out of a difficult problem using a complex solution. They've got out of it using quite a simple solution that's been quite emotionally difficult to accept.
Yeah, no, I mean, I agree with those points. And Anjum, I think in a way, your question can be split into two different levels. I mean, with your own staff, then I think actually the principles of being supportive, you know, a good manager will be listening, you know, will be providing that support that individuals need and require, and also be trying to detect those individuals that you think are more vulnerable and perhaps showing more evidence of stress themselves. So that's very much what I would be doing, and I am doing as a manager, is trying to stay in contact with people, keeping an eye out for those individuals that seem to be more affected for whatever reason than others. And clearly that can be because of the actual virus itself and the impact personally or on people near and dear to them. Obviously, I'm working with a lot of healthcare workers who are very exposed to other people who they don't necessarily know well, but seeing very traumatic sights through that. We've got the impact of social isolation on a lot of people. And I mean, I think some of the vulnerabilities there come out. You know, if you're on your own and you're isolated, I think that's quite different to being isolated with other people. If your accommodation has got no green space around it, you have no garden, then it's more difficult, I think, than if you've got a garden or something like that. If you're meant to be caring for an elderly relative, and that's very difficult because of the situation, that's going to make you somewhat more vulnerable to the impact of that, I think. So having that knowledge about your individual employees and being able to discuss that with them, I think is a very supportive stance to take. And then, of course, we've been talking a lot on this, you know, this discussion around the financial issues, but again, your employees may be vulnerable to the financial impact of this as well. And then in terms of training individuals going forward for some of the things that we've been discussing, then I think having the sort of discussions that we're having today, you know, open, honest discussions with a little bit of education in them, but also reflection on personal views about things, maybe some modelling work, you know, looking at how other people would approach a certain situation and learning from that. In fact, you know, my view is, you know, for example, if you're doing your line management roles properly and being a very good role model in that, you're probably going to be giving people some good skills they can then go into use with clients that they're seeing, with your customers ultimately as well. I think people like, you know, Mike and I'd like to think that people like us have some sort of a role in helping, you know, with education, but that can only be done in a joined up way with, you know, with companies, with individuals, so that we have a real strong feel for what the needs, you know, and requirements are, and then to, you know, perhaps offer bespoke training for individuals in that manner. So, you know, I think the principles are very, very similar, both for looking after your own staff and for helping your staff to develop the skills that they need to appropriately support other people too.
Okay, thank you.
Yeah, we definitely see the support from a training perspective from individuals such as yourself, John and Mike, is very beneficial to not only the staff, but also our customers as well. So, yeah, that's definitely helpful and supportive.
I mean, it's, again, please, it's quite important in reviewing the basics to be very comfortable about saying the same things again and again, and going out of our way to normalize uncomfortable feelings, to normalize stress and distress, and to quietly remind everybody that they don't call it a crisis unless we're all feeling it. You know, it comes with the territory. There are some people who are quite enjoying themselves, but they are in the minority. The rest of us are working hard, and it's not called a crisis casually for no reason. It's almost worth just buying people a small dictionary and being able to normalize it so that people have the right expectations. People have the right context to be able to sort of function in.
And I think that in a crisis, you know, for me, always one of the most calming things is speaking to somebody that's calm, or hearing somebody that is calm. And so I think, you know, being able to sort of have that sort of stance can be really relieving to people. And, you know, as Mike says, it does help to normalize things. You know, we're not saying that this isn't a crisis and we're not in a difficult situation, but let's look at ways of trying to help ourselves deal with it and move forward through it and find appropriate solutions.
Agreed, yeah. I think there's so much to think about as individuals going through this, but also how we can work collectively together as a team and support each other. And I don't mean that just as, you know, internally as a team. I think collectively with the customers and working with them, find solutions to help them, and being listening and supportive, as you've said, and finding real pragmatic solutions for them is what I'm taking away from this.
Being very clear, particularly with the staff on the phones as well, is that if you do this right, if you do the Jonathan Bisson way, then your patients, your clients will get distressed. They will cry a lot. So it's really important that they understand that if you do this well, expressed emotion will come your way and full on. So that's not because you've done it badly. That's probably because you've done it incredibly well, because only mean coldness shuts people down. And sometimes in your job, you may have to look someone in the eye and break, you know, really break bad news, top 3 of their life, you know, that no, this is bad. You have, you know, you have lost your house. You have done this stuff. It's, you may have to, and that's why doing it in the right tone. But so it's really important that nobody thinks that there's a happy outcome, a pleasant outcome where everybody's singing zippity-doo-dah at the end of the conversation as you do this work, because you're working with people and you're jumping down in the ditch and helping them during some very difficult times. And that's it's quite important for staff to understand that their goal mustn't be to make their clients happy. That's too high a bar. That's impossible. But to help them, yeah, that's good. Yeah. And if you're kind and if you are understanding and you're doing everything we've discussed, then please don't be surprised. People get quite upset.
I think that's covered everything really well. I don't think I've not got anything over. It's been very, very insightful, and I really appreciate both John and Mike, both of your time today. It's been really helpful.
Yeah, you're very welcome.
Yeah, very welcome. Yeah.
Okay.
It's been great.
Cheers, Em.
Take care then, and
Thank you both. Be safe.
okay.
Yeah, avoid other people at all costs.
Thank you.
Take care.
Bye now.
Yeah, cheers. Thanks. Bye.
Cheers.
Thanks for joining us. We hope you found this podcast useful. Our next video podcast will include a wider panel of industry experts. If there's anything you would like us to ask them, please comment below. Take care and be safe.